Good day, everyone. This is Chris with the Ancient Scholar, and I'd like to say congratulations. You are now halfway through the Pathophysiology course. I believe that this is week 4 that we've transitioned through. 4 more weeks to go. So hang in there. All right, this is going to be the next assignment. Looking at this, I believe this is going to be assignment number 7. All right. These are the questions. Question 1. And again, I'd ask that you would type the questions and the response and then email them to Mrs. Rosie Carrion, as you have been doing. Question number 1. Go ahead and list the normal values for pH, PaCO2, and bicarbonate. List the normal values for pH, PaCO2, and bicarbonate. Question number 2. Calculate the pH of a patient if their bicarb is 22 and their PaCO2 is 50. And we did go over a certain equation that we can use to calculate the pH given that information. So again, question 2, what is a pH if the bicarb is 22 and the PaCO2 is 50? Number 3, patient has overdosed on heroin, which is a narcotic. They have respiratory depression, and they are unresponsive. What acid-base imbalance would you expect? Question 3, I'll say that again. Patient has overdosed on heroin, which is a narcotic. They have respiratory depression and are unresponsive. What acid-base imbalance would you suspect? Question 4, what are the normal values for sodium, potassium, and magnesium? Question 4. What are the normal values for sodium, potassium, and magnesium? Question number 5. You have been called to a female in labor and delivery with respiratory depression. What medication do you need to assess to see what medication this patient is on? It's this medication we talked about a little earlier in this kind of patient. I'll say that again. Question 5. You've been called to care for a female in labor and delivery. She has respiratory depression. What medication do you need to assess for? Okay, question number 6. Sodium exists primarily within or in or out of the cell. And the second part of question number 6 is potassium primarily exists within, inside or outside of the cell. It's not both. It's either or. Sodium has a specific place that it generally exists, and potassium has a specific place that it generally exists. So, question 6. Where does I'll rephrase this a little, maybe make it a little easier. Sodium exists where? Inside or outside the cell? Potassium exists where? Inside or outside of the cell? Question mark. And you guys have to answer. Question number 7. Hyponatremia is associated with what complication? And what I'm getting at here is there is some very specific problems, complications that we talked about that are in certain tissues that are associated with hyponatremia. Okay, guys, that is the assignment for this week. Hang in there. You're halfway through. Take care.